Welcome to my channel Brainies. In today's video, I'm just going to talk about the Nih Stroke Scale. The National Institute of Health Stroke Scale is a systematic and quantitative assessment tool which is used to measure the stroke-related neurological deficit. It's been shown to be a predictor of both short and long-term outcomes of patients with stroke. It's a simple tool and it can be administered in less than 10 minutes. A trained observer rates the person's ability to answer the questions and performs the activities without making any assumptions about what the individual can do. So it's a 15-item score. It consists of the following elements: the levels of consciousness, best gaze, visual, facial palsy, motor arm deficits, limb ataxia, sensation, best language, dysarthria, extension and inattention. It also consists of subcomponents making a cumulative of 15 items. The first one is the levels of consciousness. If the patient is alert, it has been scored as 0. Arouses to minor stimulation 1. Requires repeated stimulation marked as 2. Movements to pain marked as 2 again. And if the patient is unresponsive, it has been marked as 3. And 1B is asking the month and age. If the patient answers both the questions correctly, it has been marked as 0. Answers only 1, then it has been marked as 1. And if the patient answers both incorrectly, it has been scored as 2. Dysarthric, it has been scored as 1. Again, if the patient is aphasic, marked as 2. 1C is blinking eyes and squeezing hands. If the patient performs both the tasks, 0. If the performs 0 task, it has been mentioned as 2. Any one task is scored as 1. The next one is the horizontal extraocular movements. The patient is normal, it has been marked as 0. Partial gaze palsy and it can be overcome, score 1. And the partial gaze palsy, it has been corrected with the oculocephalic reflex 1. Forced gaze palsy cannot be overcome at all if it has been marked as, and it has been scored as 2. Visual fields, no. Visual loss 0. Partial hemianopia, it is 1. Complete hemianopia, it is 2. Patient bilaterally blind, it has been scored as 3, and bilateral hemianopia, it is 3. Facial palsy, normal symmetry is 0, minor paralysis, it is 1, partially it is 2, unilateral complete paralysis, either upper lower face, 3, and bilateral complete paralysis, it has been scored as 3. And regarding the motor drift, left arm, no drift means for 10 seconds it has been scored as 0. Drift but doesn't hit the bed, 1. Drift but hits the bed, it is 2. If there's some effort against the gravity, 2. No effort against the gravity has been 3. No movement at all, it has been given as 4. If there's amputation or joint fusion, it has been given the score as 0. And the same way, the same scoring has been given for right arm motor drift, and the same components is being given for left leg motor drift. And this is the same thing, it has been given for right leg motor drifts. And seventh component is the limb ataxia. If there's no ataxia, it has been given as 0. Ataxia and 1 limb, 1. 2 limbs, 2. The patient doesn't understand, given as 0. Paralyzed, it has been given as 0. Again, amputation given as 0. Coming back to the sensation, if the patient is normal, it has been given as 0. Mild loss, it is 1. Mild moderate loss but can sense being touched is 1. Complete loss is 2. No response at all, it has been again given 2. Coma or unresponsive patient has been given the scoring of 2. The ninth component is the language. If everything is normal, it has been given as the scoring as 0. Mild is being given as 1, that is without any significant limitation. Severe aphasia, it has been given as the scoring 2. Global aphasia has been given as the scoring 3. Coma means it has been given as the scoring 3 again. And dysarthria, if the patient is normal, it has been given as 0. Mild, it has been scored as 1. Severe dysarthria has been scored as 2. If totally mute or anarthric, it has been scored as 2. Intubated or unable to test at all, it has been given as 0. The next one is the 11th, which is totally cumulative of 15 components. Extinction or inattention. If there's no abnormality, it has been given as scoring 0. Visual, tactile, auditory, spatial, personal inattention has been scored as 1. Extinction to bilateral simultaneous stimulation 1. Profound inattention has been scored as 2, and extinction greater than 1 modality has been scored as 2. So the interpretation is the levels of stroke severity as measured by NIHS scoring system is The score 0 means no stroke, 1 to 4 is minor stroke, 5 to 15 is moderate stroke, 15 to 20 moderate or severe stroke, and 21 to 42 is severe stroke. So prognosis, score, if the score is less than 5, about 80% of stroke survivors will be discharged to home. And between 6 to 13 typically requires acute inpatient rehabilitation. Greater than 14 requires long-term skilled care. That's it with my video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.